Hey guys, Dr. Matt here. So we get a lot of inquiries about the concept of a re-sleeve as a revisional procedure. So here's what it comes to, guys. If the original sleeve was constructed properly, the likelihood of your existing sleeve to be amenable to making it smaller and a true re-sleeve is very low. When you go from a 40 to 60 ounce stomach down to a 6 ounce stomach, even though there might be some natural relaxation and even though there might be a degree of stretching depending on your behavior, you might go from 6 to 8 ounces, 8 to 10 or 12. 12 ounces is still much less than the original size stomach. So when we used to do re-sleeves many years ago, it would provide a modest, if that, volume reduction from the sleeve as it existed to something a bit smaller. And patients were expecting the results and the feeling and the sensation that the original sleeve gave them. They were expecting that another time around, and it's just not the case. When you go from 60 ounces to 6, that's a profound difference. That's going to provide amazing weight loss, amazing hunger reduction, early satiety, and so forth. But when you go from 12 ounces back down to 6 or 10 ounces back down to 8, the difference is not that great, and the profound changes that one feels from the original surgery, it's a drop in the bucket the second time around. So when people are investing lots of money into such a procedure, they're getting very little in return, and that's why I stopped offering re-sleeves, unless of course the sleeve originally was performed so poorly and with such a conservative approach that it's not the 6 or 8 ounces like it should have been to begin with. If you have a massive sleeve at its initial creation, a re-sleeve is an option, but that's rare these days, assuming you went to a program that is used to doing sleeves and that has many hundreds of these under their belt and have a surgeon that's comfortable performing tight, aggressive sleeves. It's unlikely that your current sleeve is amenable to a meaningful volume reduction, and therefore you're not going to get the results that you seek. If you have additional weight loss needs, or if you put some weight back on after the sleeve and you want to get the most bang for your buck, another restrictive procedure when you already are restricted doesn't make much sense. It's better for you to consider going to a malabsorptive component by considering sleeve to bypass versus sleeve to SIPS. So this is something we can certainly talk about, and I'm happy to review everything on a case-by-case basis, but for the most part, 99 times out of 100, when someone has a sleeve and they're looking for a revision, it is irresponsible of the surgeon to consider a re-sleeve as an option when they're thinking about the global benefits to the patient. If you want to talk about this further, please feel free to reach out to us. I'm happy to discuss this on a case-by-case basis.